Okay, good morning, dear student. Now we are studying our last topic of the subject and last topic of the fifth unit, that is interpretation of clinical laboratories test. So here we will discuss the how we interpret the report, test report we received from the laboratories, pathological reports, and how we interpret the result of that particular test and correlate with the disease condition and the symptoms. So uh, just today I am giving outline. I will take this lecture again with all the reports like urine analysis I include today, but liver function test, kidney function test, and other test I will show you in next class. What does the lab result means? What are the false positive or false negative test result? Factor affecting the test results: blood chemistry, its reference value, hematological reference value, and urine analysis. Today I cover only these three. In next class I will cover the kidney function test, liver function test, and other um, pathological reports. How will the interpret the result or the report of the patient with his symptoms and with his disease. So after the referring of this particular report, physician can understand or physician can able to write the proper uh, treatment of that particular patient, and he confirm the diagnosis of that particular disease. Now lab test result may be positive, negative, inconclusive. Your doctor or your physician see this report and discuss or interpret the result or the disease condition of the patient with combining with the symptoms which is coming from the patient or which are feeling by the patient, and as well as the, pathological reports also. A positive test results means that the substance or the condition being tested for the found. The positive test result also can mean that the amount of substance being tested, whether it is higher or lower from the normal. Negative test result means that the substance or condition being tested was not found, and negative result can also means that the substance being tested for the present in a normal value. So if you got negative um, malaria parasite test, means you don't have that fever is not correlate with the malaria parasite. Similarly dengue test, similarly if you are going for the sugar test and your sugar is in between the normal range, means that test is okay for you, and it is not related with any diabetic condition or any uh, hyperglycemia or hypoglycemia condition. Now in conclusive test result are those that are not clearly positive and negative. uh, for example, some tests measure the level of antibodies to some bacteria or virus in the blood or other bodily fluid to look for the infection. It is not always clear if the level of antibody is high enough to indicate the infection. So, in this condition, is that particular bacteria present in a body, but the antibody is not prepared at that much level, then you can find out by the taste. any test. So this kind of test, we can't say the exact result of the condition of the patient. So these three type of result we are getting in our pathological report. Now, what are the false positive and false negative test results? You can see in here. A false positive test result is one that shows a disease or the condition is present when it is not present. Means disease symptoms are there. You can see the symptoms, but you can't find the that particular microorganism. A false positive test may suggest that the person has disease or condition when he or she does not have it. So he is having the symptoms like typhoid, but salmonella typhi is not present in test. He is not getting a typhoid test positive, or he is getting the symptoms similarly. Here example is there, the false pregnancy test. It is a result would be appear to detect the substance that confirm the pregnancy, but really but reality the woman is not pregnant. So that may be happened in the case of pregnancy test. That substance which are responsible for the giving the test is, if it present in a that particular sample, then it is a chances of false positive test. Now, similarly, a false negative test, the test result is one that does not detect what is being tested, or even though it is present in the body or patient is suffering from the same. So, in that condition, also we are getting the negative result, although that patient is suffering from that particular microorganism or particular bacteria. So, a false negative test result may suggest that the person does not have the disease or the condition being tested for, uh, when he or she does not have it. Example, you can see the a false negative pregnancy test result would be that the it does not detect the substance is not present which is responsible for the confirmation of test in the sample, but that test is negative, but in reality that woman is pregnant. So this kind of test you can see in the malaria and in the dengue also. Sometime we are having the fever with shivering or with cold and chill, but then also we are getting the taste of malaria parasite negative. But actually it was malaria, and you have to go for the treatment of malaria. Now, what if the result are different than the range? Then it is possible to have a result that if it is different from than the reference range, even though nothing is wrong with you. Uh, in uh, in the case of kidney patient, you can see the creatinine level is increasing in your blood, but you can't find any symptoms for a year of year, 2, 3, 4 year, 5 year. You are not getting any symptoms, but if creatinine level is increasing, it means your uh, working of kidney is slightly decreasing day by day, and ultimately result become a kidney failure, and you have to go for the transplantation or dialysis. So it is also called a silent killer. So here you here you are not having any symptoms, any kind of symptoms, but your creatinine level is slightly increasing day by day, like that. So if you are not aware, or you are not going regular or in some interval testing for the your samples, So you can't find out this kind of disease which are having with you without any symptoms. So sometimes certain factors can affect your test results, such as pregnancy, medicine you are taking. If you are taking the any kind of medication, then your fluctuation of result may be possible. Your food habits and eating right before the test, that also affect your results. Smoking and any kind of alcoholism or any kind of bad habit also affect your result. Being under stress condition also affect the result, or that reference, it's differ from the reference values. Some blood chemistry reference value you must know, or this value you can find out in a your test report. Sodium concentration 135 to 145 millimole per liter. It is a reference value or normal value. Potassium is 3.5 to 5 millimole per liter. The concentration of sodium is decreased when the excess water and water intake, or the you are taking the diuretic drugs, or you are suffering from the uh, any severe dehydration. At that time, that concentration become a decrease. It will increase in the case of diabetes insipidus, and some renal problem or some kidney function also. And this particular iron also decreased by the less absorption from the GIT and excessive secretion from the GIT also. Similarly, the potassium, its value is 3.5 to 5 millimole per liter, and its concentration is increased with the renal dysfunction, acidosis, potassium aspartic diuretic, or hemolysis in burn condition and crush injury. In that condition, uh, and the concentration of potassium will decrease from the mm, normal value by the taking of diuretics, or some alcoholysis caused by the um, your food, or taking the any kind of medication. Severe vomiting and diarrhea also reduce the level of potassium. This is the carbon dioxide level, that is 22 to 28 millimole per liter. It is available in the form of bicarbonate, which is dissolved carbon dioxide, which is dissolved in a water and form hydroxyl ion and bicarbonate ion, H plus ion and bicarbonate ion. It disturbed by the disturbing of acid base balance of the body. It is also maintained or regulated by the pulmonary respiration and this renal function. Similarly, BUN, that is blood urea nitrogen. Uh, you get this in the form of abbreviation also. So you must know the full form. Blood urea nitrogen. The value of 2.8 to 7.1, that is millimole per liter, that is normal value, is excreted through the kidney, and the concentration of urea will increase if renal dysfunction, or you are taking the high protein diet. Uh, Similarly, the in GIT bleeding and uh, blood volume blood volume reduce or GIT contraction, or they may increase the blood urea. That creatinine, I told you, this is a silent killer. The concentration of creatinine will not give any uh, symptoms to you in your body, but that is very, very uh, dangerous and very uh, significant value for the knowing the working of kidney, our kidney. If you are going for routine checkup and your creatinine level is within a range, it means your kidney is working fine. But if you are having some creatinine level up and down, then that is a severe problem with a kidney or kidney dysfunction. So if you are going for the kidney function test, then the important value to you must the check, that is creatinine level. It is excreted through the renal, and concentration of creatinine increase when renal dysfunction or kidney dysfunction occur. Now, similarly, the glucose level in a blood glucose level, that is differ from book to book normal value. Here it is mentioned in 70 mg to 99 mg, but it is vary from 70 to 115 also is okay. When concentration is increased, glucose concentration is increased in the body, that is called hyperglycemia, and this condition is known as diabetes in common language, and it is occur due to the effect of or dysfunction of isolate of Langerhans or pancreatic pancreatic secretion, and this balance of glucagon and insulin hormones, or this uh, majority of the people is suffering from the diabetes, type 1 type 2 diabetes, that is glucose insulin dependent or insulin non dependent diabetes, and this test is very common for them. Now glycosylated hemoglobin, that is a concentration of hemoglobin used to access average blood glucose during the 1 to 3 month, helpful for the monitoring of chronic blood glucose for the diabetes patient. Now, uric acid. This uric acid concentration is very much important in the case of gout disease, or patient suffering from the uh, uh, arthritis or gout, or something pain in a knee pain. That is a accumulation of uric acid in a joint, uh, that is occur normally in a old ages patient. In the case of gout condition, the uric acid level is increased when you are taking the treatment of cancer, or you are taking the treatment of neoplastic drugs. That also may increase your uric acid concentration in a body. Similarly, the proteins, albumin, its normal range is 3.3 to 4.8 gram per liter. Uh, in liver disease or malnutrition, it concentration directly affect, and uh, if protein is passing through the uh, hemorrhage condition, or through the kidney dysfunction, so it also uh, affect the value, normal value of albumin, and this directly related with a kidney disease or liver disease. So, as per your symptoms, physician can understand the condition of the patient or the cause of the albumin rise or decrease. Now, this is potassium level. Conventional unit is 150 unit per liter. Intramuscular injection by it is increasing, increase that particular level, and acute psychotic episodes also, or psychotic uh, disease also affect the level of this. Now LDH, that is a hormone, and this unit is 200 unit per liter is required in the case of malignancy, extensive burn, renal disease. This condition, the level of LDH is increased. Now CRP, that is 0 to 1.6 milligram per liter, and this can be vary by the patient to patient, and it is occur when the highly acute inflammation in the body, or any pain condition or swelling condition in the body, or accumulation of body fluid in the body also cause the same. Now next is hematological lab values, that is a concentration of RBC in male, that is 4.3 to 5.9 into 10 raised to power 6 RBC per microliter. That is, uh, if concentration is in anemic condition, or bleeding condition, this concentration of RBC will decrease. Similarly, the normal range of in female 3.5 to 5 into 10 raised to power 6 microliter, and this concentration may be increased the chronic hypoxia when your oxygen level is less, or person who is uh, continuous smoking, or chain smoker, they are having, they got a concentration of RBC is higher. So chances of RBC concentration may be higher, and hemoglobin concentration may be increased in that kind of person. Now this is a second is hemoglobin in male. It is ranges between the 14 to 18 gram per deciliter, and uh, in female, that is a 12 to 16 gram per deciliter is a common range. In anemic condition, chances is lower hemoglobin may be chances. This is a MCV, that is volume. It become a 76 to 100 millimeter, and the for the RBC size of uh, increases in the macrocytic anemia condition, and in the RBC size is decreases when microcytic anemia condition. Now concentration of WBC, that is 4,000 to 11,000 in between it ranges, that is normal value. But when uh, any infection is occur or arise, then the concentration or RBC is increased. Similarly, the concentration of platelets, that is 150, uh, 1.5 lakh to 4.5 lakh per microliter, or in the case of uh, it decrease the risk of severe bleeding arise. In the case of
Okay.
dengue fever, we
Sure.
will get the same kind of symptoms or same kind of reference value of platelets. Now next is, this is microcytic and macrocytic uh, RBCs. When the RBC site is decreased at certain level, that is microcytic RBCs, and here you can see in a picture that is a macrocytic RBC. You can see in the slide. Now in urine analysis, there's some reference values given here. Why urine analysis is required? That is general evaluation of health, diagnosis of disease or disorder of the kidney and urinary tract, the diagnosis of other systemic disease that affect the kidney function. It is also related with the kidney function. The monitoring of patient with the diabetes, that is also a tool to detect or to monitor the glucose level which is passes in a urine. Now, screening of drug abuse like sulfonamide and aminoglycoside, that is also find out with the urine analysis. Now, abnormal constituent of urine, that is sugar, in the case of diabetes mellitus or endocrine disorders may cause the glucose level or glucose in a urine. Similarly, the protein is an abnormal constituent. Uh, Commonly, albumin passes through the urine. If albumin is present in a urine, it can be due to the kidney damage. Now, third is bile pigment like bilirubin. It passes through the, and your urine color become a yellowish or dark yellowish in the case of jaundice. Now, next is ketone bodies. That is, ketone bodies normal value is 3 to 15 mg in 24 hours. Because of starvation condition, continuous person going for the fasting at that condition, maybe chances is there ketone body may be present in your urine analysis. Also, in the case of diabetes mellitus, there is a chances of found the ketone bodies in your urine. Now, a urine analysis test. First, we can check the volume of urine. That is total volume of total volume of urine in the entire day. It's differ from 700 to 2.5 liter in adult. Uh, by the appearance, we can find the clear color ranges from pale yellow to deep gold, and third is specific gravity. That is normal range is 1.003 to 1.025. Similarly, we can find out the pH of urine, that is 4.5 to 9 is the normal value. So this much from today, this much from the today's lecture. If you have got any doubts regarding the interpretation of laboratory result or pathological test report, then you can ask me through the mail or through the message, or you can write also in chat box. Uh, Now today's our entire syllabus is over. Pharmacy practice syllabus is completed. All 5 units is completed. Some test, some laboratory tests are remaining that I will take in next class. After that, we will start the revision from the third unit. third unit, fourth unit, and fifth unit. Again, we will go for the revision. Uh, Students, they didn't attend the class, or they want to again read the same chapter, or again attend the want to attend the class, they can join. I will take my classes in the morning time, that is from 9 to 9:40 or 9:05 to 9:45. So be aware. And next 3 days I am on uh, some training courses in Sage University Bhopal. So I am not going to take any class in next 3 days. So and remaining class will be on time. So take it note. Thank you very much. This is from my side. Thanks all for joining.